Back with Paige from Advantage Athletic Therapy. I haven't seen you in a while. You look fantastic. I know you love being a mom. Good to see you. How are you?
Good, thank you.
And we usually do 39 seconds, but I got to keep you a bit longer today because I got some questions. When you were helping me with my shoulder problems, I want you to sort of walk folks through when they come in the door because you have a whole system you go through. You ask a lot of great questions. Can you sort of tell us about that a bit?
Yeah, definitely the first time someone comes in, we'll do a full assessment and a history. So that would asking lots of questions about, former injuries. Have you ever done this before? Have you seen your doctor? All those kind of questions and digging more into why you might be injured and what the injury might be. So usually I have an idea or usually three ideas of what's going on before I even lay my hands on the patient. And then we'll do like a assessment of the joint or the joints above and below what's going on with the person. So for your shoulder, we kind of looked at your neck and your elbow as well as the shoulder to make sure everything's moving together. And from there, our appointments are usually an hour, the first one. So, 30 minutes kind of digging into that assessment and then 30 minutes of treatment too. That way we get a better idea hands-on how things are feeling and what we need to work on. And from there, I'll send you home with an exercise program as well to do on your own time.
I got to ask because one of the things, and I've been to other therapists and they're all great, don't get me wrong, but I think too, when someone comes in, do you kind of look at their mental outlook as well? I know that's not your job by any means, but when I came to see you, I was pretty down. Like I was pretty beat up. The shoulder just wasn't working for swimming. Nothing was working. And that can add a little, that can put stress into your own personal life. But I loved your upbeat, your personality really fit well with me. And I thought, well, you know what? I'm listening. I was open-minded about it. And that's kind of critical, isn't it? Like, do you kind of take that into consideration when people come in? You've seen athletes, you've worked with so many and just everyday people who it's tough, isn't it, mentally?
It is, yeah. And at every level, just, a grandparent wanting to stay active with their grandchildren or an elite athlete, we have to remember as the therapist, this is taking a toll on everybody or on this person's everyday activities. So I definitely try and put myself back into the patient's shoes and, not just look at them as another patient that I'm seeing that day, try and relate to them and why this might be affecting them so much. I would say that definitely you and I had a connection, like I do connect with most of my patients. But if you're a client or a patient of another therapist or of mine, and you're not feeling, that you're being heard by your therapist or being motivated by them, then, that's not maybe the best fit for you. You need to find someone else that does make you motivated to get better and excited to come into your treatments all the time. Now, I will say I can tell, someone comes in with a negative attitude, I don't think this is for me, this isn't going to work. I will turn things on them and say, this isn't just about me and what I can do for you. It's what you can do for yourself too. So, I always use the line, I see you for 30 minutes a week. All those other hours in the week, what are you doing to better yourself and your injury? So I do encourage people, that our exercise programs, they're there for a reason and you need to put the work in. And we work as a team to get better.
Perfect. And one of the things I wanted to ask you about too is when you recovered, and I've been doing, you and I were talking off air, I've been doing runs every day for a long time, but I was surprised both aspects of it, physically and mentally. Like when I train for a race, this is how I do it differently, but I've sort of just accepted this in the last year with the way everything was with the pandemic and just go out every day and enjoy an easy run. And I found that it really kind of was very self-motivating to get back into that phase where I wanted to get to. And I think as athletes or as people in general, sometimes we forget how important it is, isn't it, to get out there daily and do a little bit of something, not overdo it, just enjoy it. I think that helps both physically and mentally. And I'm sure you're a big proponent of that.
Yeah, for sure. Again, always a balance, right? I have patients that come in and are going too hard, too quick, and I have to pull them back and say, these are all the reasons you're not getting better. You're doing this, this, this that are affecting your injury. So, educating them on working out or doing activities that are going to help in the healing, not negatively. But then, yeah, I do have patients too who aren't as motivated. So just encouraging them, a little bit of movement. I'm not asking you to do a hour workout every day, but your 5, 10, 15-minute exercise program, and maybe get out for a walk or a
Yep.
bike ride or whatever is going to benefit your injury and your body.
When folks come to you with a long-term injury that's going to take, let's say, 6 months to a year to properly heal, boy, that's got to be hard on both you and the patient, right? Like, how do you say to them, this is going to be a while? Because I don't know personally, I don't know how I would cope with that.
Yeah,
Is
it
there other
is hard.
mechanisms you kick in there? Like, I mean, do you look at it in increments of baby steps?
Yeah, I try and, I do try and give people the big picture because sometimes they're so far off with what their expectations are, something that's going to
Hey,
be
I'm
6 months.
right here.
They're
Don't
like,
talk about me like that.
like, yeah, 4 weeks. Hello. I'm like, no, no, no. So I do try and say, like, this is, the average time that it takes this injury to heal. But, our goal for this month or this week or whatever it might be is to get here. And you're going to see these small changes. And so just really try and make it so that the patient sees those changes and gets excited. Now I can do this. Now I can do that. And I couldn't do that before when I came in. So small goals are really encouraging and motivating for my patients and
And
clients.
just pain relief, eh? Like, that's so huge because then you feel like you're healing. All right.
Yes,
I know
definitely.
you're busy, busy. Thanks for doing this today. Please take
Thank
care.
you.
Say hi to the family, okay?
Thank you so much. We'll talk soon.